All right, welcome back. We're answering all of your dental health questions. We have Dr. Malik Johnson here with us. Good afternoon, and thanks for joining us today. All right, so we have a few questions here. Can adults possibly have baby teeth? I have heard people say they still have some or one.
Yes, it's rare, but it definitely happens. I always enjoy it. It kind of makes me laugh. But sometimes you have a tooth that you can be congenitally missing, meaning like missing from birth. You never had it and you're not going to get it. And then in that case, that baby tooth will still sit there. I have a couple patients who will come in. Sometimes they have the silver crown still on the tooth.
Mm.
Sometimes it's just a little baby tooth, and we have to make a decision about it. Like, you want to keep it, or you want to get an implant, you want to get a veneer over it, those type of things. But if it's there, I mean, it's not like it's a problem, and we need to remove it or anything. It just is the case. But if you don't like the way it looks, come see us, and we can talk about some options.
All right. Well, what do dentists check for in routine dental visits? What are you guys checking for?
So when I typically come over for a routine visit, of course, I introduce myself. And my first question is, what are your concerns? What brings you in? Is there anything you want to talk about? Anything specifically you want me to check out? Right? I kind of always start there. Generally, I've already kind of looked at the x-rays and I see some things that I'm looking for. But overall, we're looking for, of course, cavities. We're looking for things we think you may, you know, want. Like if I see you have some spacings or some things like that, I'm checking that out. I'm checking the soft tissues, so your gums, your tongue, inside of your cheeks, for anything out of the ordinary. So that's really big for people who, use tobacco products or smoke or just have certain habits, and that leaves your mouth more susceptible to different diseases. Sometimes even those, C word kind of diseases. So I'm just looking at everything, right? Um, and if your teeth are fantastic, then I'm giving you praise for having great teeth. So it's just a general sweep, trying to make sure, I address any needs you have, any pain you may have, and plan anything that can address cavities, anything like that.
Now, what happens if someone is on vacation or something and they have some issues going on with their teeth and they obviously aren't there to see you all in person? What can they do then?
Definitely you want to, Google something about a local office that may be open. Different parts of the country, of the world have, dental clinics that may be open different hours. Sometimes there's 24-hour emergency clinics. Sometimes urgent cares can have a dental unit. Sometimes most hospitals have dental units. I worked at a residency in New Orleans, and I was in a hospital where we would take call and try to address people's needs when we can. But definitely want to Google. We have a line that we take emergency calls on too. So if we can't necessarily get our hands on you to treat you and help you out, we can at least maybe get you a medication that you may need, or maybe get you in the direction of someone that's local that can help.
Hmm. Next question. Is it necessary to get permission from your cardiologist to get your teeth cleaning if you were on a blood thinner?
So no, not necessarily for just a regular degular cleaning. Some instances, if you need a deep cleaning and you have an extensive medical history that includes like pacemakers or heart valves, then yes, we will get clearance from your cardiologist. But generally, just for a cleaning, even generally just for a deep cleaning, you're not going to have to come off your blood thinner. We can typically manage that level of bleeding in the office. However, if you're getting an extraction, depending on how many teeth, depending on what kind of blood thinner, typically an everyday aspirin is fine. If you're on something uh, a little stronger, then we can seek out medical clearance. And that's not a problem with that. Typically, I'll be safer than sorry and go ahead if someone reports some type of heart issue, some type of extensive medications list, then we will get that, but not in every instance. Everybody's different, so we can always talk about it.
We got one more question, probably got 30 seconds to answer. Is it better to get a tooth pulled or just do a root canal?
It depends, like everything. But in some instances, a tooth is too far gone and we can't do a root canal, so we do extract it. In some instances, I'll encourage you to get that root canal. If it's a tooth that you're gonna really miss as far as chewing and eating, and as far as smiling, I'm gonna try to encourage you to save it because there's nothing better than your own God-given tooth.
All right, Dr. Johnson, thanks so much for joining us. If you missed this entire conversation or you want to see the entire conversation, you can do so on our website, WFMYnews2.com. We'll see you at 6.